When I was in high school, like many of you, I was on a path. And my path looked something like this. In high school, I'd get good grades, I'd do my extracurriculars, take the SAT, and I'd get into college. In college, I'd get more good grades, do more extracurriculars, and then I'd get into med school. And then after I finished med school, I'd be a doctor. For all of us, at some point, whether our path ends up at being a doctor, being a teacher, an artist, whatever it may be, we have to answer the question for ourselves, why do we want to be on this path, and what do we hope to get at the end of it all? And for me, my why was to help people. I wanted to have a positive influence on the world, and I truly felt that by following this path to the end, was the best way for me to do that. And so today, I want to talk to you about how that idea that to reach my goal of helping people, I had to follow this path to the end, it's totally wrong. And sometimes, by straying from this path, especially as a young person, that can take us even closer to our why. In college, I was on the path of an aspiring doctor, and my first year of college, when winter break rolled around, I did what a lot of people on this path did. I signed up for a community service trip. So for 2 weeks, I went with a group of 15 to 20 college students here to Cochabamba, Bolivia, where we worked with local communities to build toilets and other sanitation infrastructure. So this is the place that we worked. It's an area where about 100,000 people live, and this area has no running water, no plumbing, no sewage systems, no place for these people to go to the bathroom. What struck me about this trip, though, was that these communities were inviting the same group of 15 to 20 college students year after year to come back and help them and improve their sanitation. They were inviting a group of college students, not professors, not doctors, not engineers, just college students. And so I thought, here we are helping people doing what I thought I'd have to wait another 5, 10 years before I got my medical degree to actually be able to do. And here we were doing it in some small capacity. How does that actually make any sense? Turns out that many of the world's problems don't require a professional degree or lots of resources to solve. Many times, important issues in the world don't need a special someone, they just need someone who cares, and someone with the time and effort to put into working. So we spent these 2 weeks, and we ended up making these bathrooms for these communities. And so throughout this process, it raised this question in my mind: how can young people find more of these problems that don't require lots of knowledge, lots of resources to work on? So I want to share 3 principles for how, as young people, can identify these problems to take on. So first, you want to find a problem that's important and meaningful, not just to the people affected by it, but to you. Because when you care about a problem, you channel your passion, and your passion leads you to feel more confident about taking on the work. Second, you want to find a problem that not many people are working on. Because when not a lot of people are working on a problem, maybe it's an ignored or neglected issue, that leaves room for young people who, even though we may not have much expertise, we can still make some initial impact. And third, you want the problem to be tractable. This means that you don't want to take on a problem that's so complex and difficult that you won't have any chance of making a small impact. So take our case in point. We were working with this large community, this large area of Bolivia that didn't have running water. Is this an important and meaningful problem? Definitely, we were hearing that from the people every day on the ground. Was it ignored or neglected? Unfortunately, even the government wasn't doing their part in supporting these people, and there certainly weren't many other organizations doing what we were trying to do to help them improve their sanitation. Was it a tractable problem, though? This is a huge issue. It depends how you think about it. Could we as college students help this entire area of 100,000 people get a fully functioning sanitation infrastructure with running water, plumbing, and sewage management? Probably not. but could we help a small number of families go from having absolutely no place to go to the bathroom to having some functioning solution? That was a more tractable problem. And so that's what we did over these 2 weeks. We ended up building 5 to 6 bathrooms for these families to use. And so by the end of this trip, I had the feeling that maybe I don't need to be waiting 5-10 years until after I have all this education and training to make a small difference. So back at school throughout the semester, I was talking with my friends and we were thinking about how we could go back to Bolivia and implement an improved design for a toilet, and how we wanted to do a health survey to understand more of the community's needs. And then the summer rolled around and I was faced with a choice. I could either do an internship program, do research with a professor, I could take a summer class, go the well-established route, or I could go with a couple of my friends to Bolivia and keep working on our projects with no adult supervision and no guarantee of success. So I did what any confident and bold college student would do. I made sure I had a backup internship before I booked my flights to Bolivia. But luckily, I didn't need that backup internship because we had an amazing trip. This is a picture of my friends right after we had gone through the Bolivian markets trying to pick up all the supplies we needed to build our prototype for this new toilet design. That's my friend Lathan waving from the back of that truck. Lathan was BCA AMST class of 2015 as well. That's the face of someone who's just roamed the roads of Bolivia on the back of a pickup truck. This is a picture of my friend Hirsch, who took the lead on constructing this new toilet that only requires 1 cup of water to flush. He worked on this with the help of a local construction worker. And so while some of us were working on building this new toilet, Lathan and I went door to door to these communities, asking them questions from a health survey that we'd written to learn more about their needs. We soon realized that these communities, there were no maps. We didn't know where we were going. We had no way to track which houses we had visited, so we ended up having to draw out a map of these communities by hand to figure out where we had to go. And we also soon realized that the two of us weren't going to be able to canvass all these houses on our own, so we ended up giving a talk at a local nursing college and recruiting over 100 nursing students to help us collect data from all these households. So needless to say, this summer was an amazing experience, and it left me feeling empowered that college students and young people could really have a tangible impact and make progress towards these difficult issues. But there was one problem. By the end of the summer, we had run out of money. And so this was a turning point. I could say, I had a good summer, I had a good winter break, but now it's time for me to focus on my schoolwork, focus on my grades. But that's not what I did, because these experiences, working on real-world problems, they give us the opportunity to discover a higher purpose. They remind us why we're on this path in the first place. And so my friends and I, we decided to stick with it, and we tried however we could think of to raise more money. And then finally we got a lucky break. We won our first grant, $25,000. And so this gave us the momentum we needed to keep going. And with more funds, we were able to serve our communities in a bigger way. When we told our local partners about this, they were ecstatic. But we knew that this meant a lot more time and a lot more energy for us. Up until now, we were giving these communities toilets and bathrooms, but we were working with individual families. Now we had the resources to help them in a bigger way, and we knew what that meant. These people needed healthcare. The areas that we worked, healthcare was geographically, economically, and even linguistically inaccessible. The communities where we worked, those members, they were asking us to build them a health clinic. And if you told me in high school, when I was in high school, that in a few years I'd be asked to build a health center in the middle of South America with a couple of my college buddies, I would have laughed. But the little experience that we had from working the past year made us feel like maybe this isn't such a daunting task after all. let's think about whether this problem, using that framework that we talked about before, was this problem important and meaningful? Definitely no question. Was it ignored or neglected? We knew that if we didn't step in now and try to work on this, the government certainly wasn't going to help, and there weren't going to be any other organizations to take on this project in any time soon. And was it a tractable problem? Maybe for a couple of college kids who had never been to Bolivia, who didn't have much experience dealing with real-world problems outside of what they'd read about in the classroom environment. Maybe not. But for us, the little experience we had made all the difference. Now when we told our professors about what we were doing, we could point to the past work, the past projects that we had done in Bolivia, and that gave us some credence. Some of our professors still laughed at us, but the ones that didn't became our advisors. And they gave us guidance, they pointed us in the right direction, and they gave us encouragement. For the next year, we did intense research answering the fundamental questions. What would be the purpose of this clinic? Should we even be building a fixed building? Should it be a mobile clinic? Who is it going to serve? How would we staff it? How would we manage it? We were putting in so much time. We were putting in 15, 20, 30 hours a week to thinking about this issue, working on it, in addition to our other obligations as college students. One of our teammates even spent an entire year living in Bolivia. And while we were putting in all this work, it gave us confidence. It made us feel competent. It made us feel like we belong in this space, that we had the ability to contribute in a meaningful way. And this confidence allowed us to interact with people twice, thrice our age. It allowed us to have meetings with policymakers, asking them, how come the government isn't stepping in to help these people? It gave us the confidence to talk to doctors and engineers and architects to figure out how should we best design this building. It even gave us the confidence to talk with people like the First Lady of Bolivia or Bolivian national TV news stations to tell them about the work that we're doing and to gain more coverage and raise more money and awareness. In the end, we ended up partnering with a local nonprofit called Fundación Ranchis, and we decided to build 2 doctors' offices right next to their existing community center that lots of members frequented and had a lot of trust in. There was one issue left, which was how are we going to staff this? So all of our preparation that we've been putting in the past years, allowed us to prepare for a meeting with the local government. And we ended up successfully negotiating a contract with them, where they promised us for 5 years salaried doctors and nurses to staff our health center. In early 2018, we began construction, made progress over the next few months, and completed construction of our health center at the end of the summer of 2018. In September of 2018, our center opened its doors, and to this day, that health center in Cochabamba, Bolivia is serving a population of over 5,000 people. I've been talking a lot about how I strayed off the path. I chose to take these risky opportunities that had no guarantee of being successful. But it wasn't just me alone. Along the way, our movement has grown to cover and expanded. And our organization now consists of over 200 students from over 5 universities around the country. All these students had one thing in common. They realized the potential impact of young people taking on real-world problems. It's not going to be easy. It's certainly not the well-established traditional thing to do that all your friends are going to want to do too. But if there's anything that we as young people can learn from our experience, is that young people can make an impact. Thank you.